Hey guys, Dr. Cohen with the Cohen Clinic. So I want to talk about one of the common questions we get almost daily, and that's what is a deep plane facelift and how is it different than a traditional facelift? So the main difference is in how you are releasing the tissues of the face. So there's old school facelifts are basically a rhytidectomy, which means removing wrinkles in the face. That's a skin-based operation. This was done decades ago where you're basically just opening the skin, tugging on it, and closing it. No one's doing that anymore, largely speaking. So a traditional facelift, what most people are still performing, is something called a SMAS lift, S-M-A-S, which basically means you are separating the skin from the underlying surface. That's the SMAS layer. It's this muscle layer in the neck and a fibrous layer that extends into about the lower cheek. Taking the skin off of that, you can then do something to the SMAS layer from above, and then you can tighten that, get a nice improvement in the jawline, and then you pull the skin over that and you close. That's a traditional lift. It's done by at least 95% of facelift surgeons, even today. A deep plane facelift is different in that you are not separating the skin layer from the underlying SMAS layer. Those two naturally attached layers are preserved together. The key is that you are now going under the SMAS layer itself. You are releasing a natural layer where the face wants to separate there, and that whole structure is then gently repositioned. There are many, many advantages to doing it this way. The key difference is that you are not pulling on the skin, so it's impossible to look tight or windswept, and you look natural. You're repositioning the beautiful volumes of the face that have come down and just need to be brought back up. So we're not talking about distorting or changing or tugging or pulling tight. We're simply talking about rejuvenation. It's a key difference. So that's a deep plane facelift. Very, very different. It's done by a very select few surgeons right now in the country. It's my preferred technique. I'm very comfortable with it. It's the one I do most often. So if you have more questions, please reach out. You can comment below. I try to get to them as soon as I can, but I hope this helps a lot.